Good evening, everyone. I'm Jovita Moore. George has the night off. Right now, many Georgians are breathing a little easier after watching the governor announce that some businesses will reopen Friday. This means people can get back to work, money for small businesses, and a return to some of the little things that we enjoy. So starting Friday, you can work out at your gym. You can get a haircut. You can get a manicure and a pedicure at your local nail salon. Tattoo shops can also open again if you need to get tatted right now. And remember, these businesses still have to social distance in order to stay open. Also tonight, some people just cannot believe what the governor announced today at the state capitol. We took a poll, and the results aren't even close. First, Channel 2's investigative reporter Justin Gray went one-on-one with the governor Kemp today to give you a better understanding of his reasoning for this.
What do you say to those people who say this is too soon? You're taking these steps too early.
Well, look, I'm following the advice of public health officials and the data, and we meet the criteria. I think it's a measured step. I've been doing measured steps the whole time going into this, and now we're going to do that going out.
Monday evening, I spoke exclusively one-on-one with Georgia Governor Brian Kemp about his plan to get Georgia back to work. Governor, what about the data made you convinced that this is the time to take these steps?
Well, I think really just trying to get, comfortable with what our data was showing, what Dr. Toomey was telling us, and where we fit into the phase one of the president's plan to meet the guidelines to kind of move into this.
A critical piece of that decision, the change of the date when Georgia is predicted to need the most hospital resources because of COVID-19. New models reveal we may have peaked 5 days ago.
The model changed here into last week. It really, I think, sped up our thinking a little bit. I mean, we were already thinking in this direction, but obviously when you have a model that says the peak was behind you, we started asking those questions, why is that? And through those explanations, it just got me in a good place to put the announcement up today. Look, we still got a few days before it happens. We need people to continue to buckle down and follow the guidelines and physical and social distancing, and we'll keep moving into a better place.
A big part of the state's ability to free more bed space in our hospitals included delaying elective medical procedures and creating a 200-bed hospital at the Georgia World Congress Center. Now, Governor Kemp says there is space for Georgians to have those important medical procedures done.
Definitely better prepared to respond than we were a month ago. I mean, we have, the makeshift hospital facility, 200 beds in the metro area. We've stood up, other facilities around the state, or we're in the process of doing that. Our hospital, I have had elite conversation with hospital CEOs, especially here in the metro area. I mean, their bed count is going down because they haven't been doing a lot of these procedures. And I asked them about elective procedures to build revenue and to get some of this work. And plus, you have patients out there, that are in a lot of pain because they need a hip replacement, or you got kids that need their wisdom teeth out. And if you keep waiting, that'll be detrimental, or harder surgery. So we want to allow those things to happen.
What about the concern that with all these people heading back into the world, that we're going to start seeing the cases all over again and be in a worse situation than maybe we are right now?
Well, I would be cautious to say everybody's heading back into the world, because this is not just, throw them the keys and open things up, business as usual. As I said in my remarks, people are going to have to follow guidelines. We're only opening certain businesses up this Friday. We're going to let the restaurants start gearing back up on Monday, but they're going to have to adhere to the guidelines. It's going to be a new way of doing business. I don't think that'll be sustainable for them long term, but look, to get them up and going, to get them some revenue generated so they can hopefully save their business, I felt like that was very appropriate.
The governor did not rule out putting new orders in place if we see a rise of COVID-19 cases after Georgians quit sheltering in place.
I said in my remarks today, if we start having flare-ups or problems that really get out of control, then we'll take further action to reel that in. But right now, we're prepared, to have people that get the virus. What we want to do is limit the people that are really can be hammered by this disease, and that's those elderly folks, and that's why we're continuing to focus and even throw more resources at our long-term care facilities, not only with cleaning and protocols on infectious disease, but also with testing.
Channel 2's Justin Gray joins us live tonight. So, Justin, how does the governor plan to get enough testing done to monitor the virus as we start to reopen and let folks out in the public to do whatever it is they need to do?
Well, Javita, testing was one of the criteria set aside by the White House to enter this phase 1 of reopening. And the governor himself told us that he has been frustrated by Georgia's lack of testing. He announced today a new app you download on your phone where if you have systems, you can put that into the system. Augusta University is running it, and it will give you information on how to get a test. You're going to be able to get that test, according to the governor, the results back within 72 hours. Emory University, Georgia State University also participating in this, and lab work. They're also going to be having 3D printers printing thousands of the swabs right here in Georgia. So the governor says within this week, we should see that testing capacity ramp up. Of course, that is the big question. Is that going to happen? That's a key part of keeping people safe as we start to open these businesses up.
So when you listen to the governor, Justin, it sounds like he's saying we got public health to deal with versus the economy at this time. So we'll see what happens starting on Friday. Justin, thank you.